Given that 100% of people will have this symptom in the postpartum period, we really wanted to talk to you about it today as reproductive psychiatrists. My name is Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Okay, today we're going to talk about what we call intrusive thoughts. So let's start off with defining what they are.
So intrusive thoughts are usually really scary thoughts that intrude or kind of invade into your mind without you really having control over it and without you really wanting it to be there.
Mm-hmm. Mine show up, and I've heard other people say it will show up sort of like a what if. What if this thing happened? So I kind of ask people often when I'm seeing them, do you have any kind of this, like, what if this would happen?
I usually say, have you been having any scary thoughts or images of like something bad happening to your baby or to yourself or to another loved one? So they can kind of show up as just like images or actual like what if thoughts.
Mm-hmm. Mm-hmm. So I think it's important to note that studies show up to 100% of people with or without psychiatric diagnosis or disease will have this symptom. So I say it's relatively typical in the postpartum period for people to have this.
Or in pregnancy.
Yes. I see it more in postpartum.
Yeah, it definitely happens more in postpartum.
Yeah. And that having these intrusive images or what if XYZ happens does not increase the risk of violence.
Yeah, so a lot of times people are so distressed and anxious about these thoughts because they think this means I'm going to hurt my baby, or what if I lose control and do this thing that keeps popping into my head, or how could I have this thought like I must be a terrible person?
Mm-hmm. When none of those things are true. It's just a thing that our brains do that feels really bad.
Yeah, I like to say it as like our brains, we're kind of designed to be on the lookout and keep our baby safe and keep our environment safe for our baby. And some of our brains are just extra good at doing that, of like picking out all the possible things that could go wrong.
Right. And I will say that the issue there is really that often people worry about what could I do if I lose control, or I don't want to do that. And I would just say, like, the issue really is not that you want to protect your baby. It's that your brain is so good at trying to protect your baby that it will even say you could be a harm to your baby. And that is kind of the thing. Yeah. It's like, no, brain. Wacky. I mean, I do it, so.
So we don't really worry about if people are having these thoughts, especially if it's occasionally. What becomes more of an issue, and it's not an issue of like, oh, we're worrying they're going to hurt their baby or they're going to act on these thoughts. It's more like this is indicative of a mental illness going on. And that's when certain things are happening in regards to those thoughts.
Right. So if they're happening really frequently or more frequently than one would like, the severity or the content could be like extra violent, or it could be extra concerning. And then how sticky are those thoughts? How easy is it for someone to say like, oh, that was weird, and kind of move on, versus kind of getting into the what if kind of spiral that goes along with it.
Or like it just keeps replaying in their head and they can't kind of get it out, or they can't stop thinking about that scenario and the consequences or what would happen.
So that would kind of be when it moves from the area of typical to more of an obsession that can happen in people's brains, which could be indicative of obsessive compulsive disorder. And so the other component would be a compulsion. So if they're having these thoughts and then the thought is distressing enough where people want to do something to prevent the thing that's happening in their brain from happening in real life.
Yeah. And I would say that in order for it to be kind of more on this OCD scale, it's usually that it's taking up a significant time of your day each day. So maybe it's an hour, or maybe for some people it can be all day. And it's really distressing. So like she was saying, some people it like comes in and like, oh, that's weird. And then you just kind of move on. For other people, it comes in and they're like, oh my God, what if I do this thing? And it becomes really scary and there's a lot of anxiety that goes with it.
So if that's happening, then we would think about seeing someone to be assessed for an anxiety disorder, including OCD. And then if you have the diagnosis or feel like you need treatment, then we would recommend usually therapy and or medications in the SSRI category.
And the therapies that have the most evidence for being helpful around OCD or intrusive thoughts like this are cognitive behavioral therapy, or CBT, and exposure response therapy, or ERP.
Exposure response prevention, P?
Yes.
Something like that. Yeah.
ERP.
ERP type things. And I find with my patients that simply giving them a framework for what their brain is doing, having the education around this is a representation of love and care for your baby. It's just coming out a little sideways and we can kind of adjust, helps them feel a lot better about what's happening. Oh, okay, I'm not at risk of actually hurting my baby just because I had thought that my baby could be hurt.
Yeah, or that doesn't mean that you're a bad person because your brain is coming up with these thoughts. And maybe it's not always violent thoughts. Sometimes they can be sexual thoughts or other like really disturbing thoughts that people just kind of feel a lot of guilt and shame around.
Right, exactly. So everyone has them. It just matters how bothersome they are and how much they're impacting your life, whether it's on the scale of typical or maybe needs to be addressed.
And don't tough it out if you are having them and they are bothersome and they are taking up a ton of time. Don't tough it out because those are impacting your mental health. And we know that your mental health impacts your baby and your family. And so for the sake of your child's health and those around you, reach out to someone and get help.
Right, and you deserve to enjoy this time without worrying about all of the things that could or probably won't happen.
Yeah.
Right. So hope that's helpful, especially everyone has them. It's a very common question that I get in practice. I would say at least weekly.
Yeah.
Minimum. Yeah. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.